Good afternoon, everyone, and welcome to our April community chat for United to End Homelessness. I am Bex Hayhoe, the Executive Director of United to End Homelessness here with Orange County United Way. And I'm really excited for our conversation today because it's with two people who I really admire and have had the privilege to work alongside for a good few years now, in particular around the continuum of care, which is the subject for our conversation today. For anybody who's joining us and this is your first community chat, we host these every month where we bring in an expert, either a local expert, a national expert, to have a dialogue on a conversation connected to homelessness. And so all of our past webinars can be found on our YouTube channel. They are available there. We have such a wide variety of topics that I encourage you, if you ever want to grab a cup of coffee or a cocktail and learn about homelessness and watch those, head on over to YouTube. So today, I'm really grateful to be joined by Tim Shaw, who is the chair of the Continuum of Care Board, and Dr. Shauntina Sorrells, who is the vice chair of the board. And so a warm welcome to both of you. Really excited for our dialogue, our conversation, and to hear from your experience and your expertise. And so to start us off, I would love to just hear a little bit more about you. If you could introduce yourself to our attendees today, and how did you get connected to addressing homelessness in the first place? And Tim, I'll come to you first.
Awesome. Well, it's good to be here. Thank you, Bex and Michael and Amy and the team at United Way. Really appreciate the opportunity to talk about this. And then my wonderful colleague, Shauntina Sorrells. I've been working in the homeless services field for a long time. Started my career in direct service when I was at the ripe old age of 22 years old, way back in the day, with an organization called SPIN, which is still around despite asking me to lead it way back in the day. So I also ran the Orange County Homeless Issues Task Force here for a good part of the 1990s. That was a group that was formed by then State Senator Marion Bergeson and some other really amazing people who we owe a great deal to in terms of the infrastructure and the ecosystem that we've built here to address homelessness. They really were pioneers in the area. And so at my time at the Homeless Issues Task Force, I actually was one of the folks who led the first effort ever to bring the first continuum of care funds into Orange County. So this was back in 1995, and maybe later we can talk a little bit about the history and the great story of how we ended up actually getting these funds here in Orange County. But so it's been my pleasure. I've served previously as the chair of the board a few years ago. I've been on the board since about I think we joined the same time, Bex. I think it was 2017 or 18. It was somewhere around there. Yeah. So, and yeah, time flies. I'm now the chair again and just honored and proud to serve with the group of people that we have and happy to be here.
Thanks, Tim. Dr. Sorrells.
Good afternoon, everyone. I echo what Tim said about the work and who we get to work with, which is very exciting to be here today. I got started in this space myself as personal lived experience being a youth in foster care and exiting foster care. And then right as I aged into adulthood, I realized that I wanted to help others. And so started working with other youth experiencing homelessness through a youth homelessness organization back when I was in undergrad, and then started to continue to pursue that in different ways, whether working through child welfare and youth who were aging out of the system or working with families experiencing homelessness. And that catapulted until I ended up at Project Access, which was working for a national organization providing resources in low-income housing developments. And then at Orangewood Foundation for the last 4.5 years in supporting transitional age youth who were experiencing homelessness, among other things. And now at the Samueli Foundation as a funder in this space and looking in how we can contribute in ending homelessness.
So you can see why I'm so excited to have these two people at the helm of the Continuum of Care, along with our incredible secretary of the board. As Tim mentioned, I'll just put it out there. I've been on the CRC board for about 4 years, and I've had the privilege to be involved in the leadership there. And I'm really excited for this year's chair, vice chair, and secretary. I know that we throw around CRC a lot, the short acronym for Continuum of Care. And Tim, you mentioned that you were, the person that helped to bring this to Orange County in the first place. What in the world is a continuum of care? Like, where did this concept come from? What's it trying to do?
So at the risk of being the resident historian, I will take you back a bit because it's interesting because what the Continuum of Care Board is now is not what it was originally designed to be. And you have to understand that the tools we have available to us now, the coordinated entry system, the homeless management information system, even entities like United End Homelessness and those types of things. When the Continuum of Care Board was formed, we were just getting computers on our desks. I mean, we were still communicating through this thing called fax machines. I don't know if any of you remember what those are, but that's how I actually found out about the first allocation, was through a fax that the Federal Department of Housing and Urban Development sent. So back then, what HUD wanted to do was consolidate all their programs. They had a disparate grouping of programs that were supposed to address homelessness that were all over the federal government. And so they consolidated all those into what they called a super notice of funding availability, super NOFA. So you'll hear that term super NOFA still. It's still part of the vernacular. But that's how the whole thing started. And what that did, though, was that that created a situation where Orange County now had to compete nationally. So we had to compete for our dollars with Los Angeles and New York and Chicago and Seattle and every other big city. And I will tell you, at the time, there were some people very skeptical that we would be able to do that. And fortunately, there were some wonderful people at the county, Judy Crumley, Karen Roper, folks like that, Rick Epker, that were around at the time, who I really was a champion for. We got to go do this. Orange County can't keep getting passed by, and they went along with it. And so we partnered with the County of Orange, the Homeless Issues Task Force, and at that time, 26 organizations formed. And the whole purpose was to try and create more of a community-wide commitment and sense of accountability for addressing homelessness, right, in a coordinated fashion. And so bringing together and back then, we didn't even have terms like housing first or permanent supportive housing. Those weren't things that we used. We needed affordable housing, but we needed shelters, emergency shelters, services, all of those types of things. And so we received, the first allocation we received was in 1996, and it was just over $7 million that we got. And then since then, we've gotten renewals that have in total brought over $500 million into Orange County to address homelessness. So across the board. So I'll kind of stop there, and Shauntina, if you have, but I will later talk about sort of the changes that we've seen. There were some very pivotal things that happened like 5-6 years ago that kind of changed the focus, where we were no longer just a pass through for those federal HUD dollars that came to us, but we had a much broader purview.
Thank you, Tim. It's very helpful to have a resident historian on the COC in the wings to help remind us all of how it got started. Always a helpful refresher for me to have the context in which the COC board is now operating. Would love to just hear a little bit more. You talked about the role of the county connected to the CRC board. Could either of you share just a little bit more about what that looks like for anybody who is like, oh, so does the CRC board report to the Board of Supervisors because they're at the top of the county?
I'll start there, and then Shauntina, you can jump in. So yeah, that's interesting, and it can be very confusing. So if you're out there and you're confused, welcome, because I've been doing this a very long time and I still get confused sometimes. So we have added kind of an unnecessary layer of complexity into the system overall, but we have to navigate that because we don't control all parts of the system. But the Continuum of Care Board is mandated to exist by the Federal Department of Housing and Urban Development. So we exist locally, and locally, the Continuum of Care Board has to select what is called an administrative entity. So this is a group that basically provides the staffing, right, and the administration and operation for the Continuum of Care Board to carry out its work. So in some regions, that's a nonprofit organization. In San Diego, the Continuum of Care Board, their administrative entity is a nonprofit. Here, going back from the very beginning, we chose the County of Orange as our administrative entity. That provides a lot of advantages, right? Because we don't exist in a silo. We have to coordinate on a number of things, which I think we'll get into later, like where some of those cross-cutting things are with the county on things. So it really does help to share. And so right now, the way we're structured is under the county chief administrative officer, who's like the CEO of the county, who reports to the Board of Supervisors. There's a group called the Office of Care Coordination. And so at various times over the years, we've been with Housing and Community Development, Healthcare Agency, but now we are part of the Office of Care Coordination. So our staff from our administrative entity of the county comes through the Office of Care Coordination that is led by Doug Becht, who's a great partner for us. And we really rely heavily on our staff to do the work. And we have a great group of people over there. So that's the way it's structured currently. Shauntina, I don't know if you have anything to add.
Yeah, just that I think where that confusion also lies is they are responsible for the operations of shelters. We are not. And I think that's where a lot of confusion comes in. So not just shelters, sorry, but programs. So there's a lot of programs where they operate and they may be in charge of the quality of that program or the audits and then things like that. And the COC board is not in that space. And I think that's one where I see overlap in public comments and public questions about where do I go to talk about what I'm seeing or what I'm feeling or what I need. And I think that's a good distinction of they operate the programs. We just really help design where the funds should go to support what types of programs. And there's that divide there that I think gets really confusing as well.
I should also mention that, and I do want to make this 100% crystal clear because people get confused about it a lot. And I feel for people who want to engage the system and speak into it and have their voice heard and feel some sense of efficacy, like they want to make a difference. We do not, the Continuum of Care Board in no way is under the Board of Supervisors. So we partner with the Board of Supervisors. They're a super important partner of ours, particularly because the administrative entity, reports there. But we make our decisions independently. So our board is elected by the Continuum of Care membership. And if you're out there right now, individuals can be members, organizations can be members of the Continuum. There's a process you have to go through, but it's fairly simple. If you want to be a voting member and actually elect people like myself and Shauntina and Bex or not, or don't elect us. But that's how we operate. So we don't have to, even though we're a public body and we are under all open meeting laws, the Brown Act, things like that, we don't have to be elected by the general public the way the Board of Supervisors does. We are elected by the Continuum of Care Board membership, and then we function independently.
Yeah, thanks so much for digging into those factors. And I think I just want to echo something that I was hearing there. So the County of Orange has staff that support the Continuum of Care Board. And those staff are also responsible for the contracting out of the funding that the COC board receives. But then the county also has their own funding that they use to help address homelessness. Yeah. And so that's, I think, where sometimes people get super confused because they feel like it's the county funding all of these things. Sometimes it's the county, sometimes it's the COC. But because the county is the admin entity of the COC, they are the ones dispersing the funds and doing all of the contracting.
In fact, I think one thing that's to jump off of that a little bit, I think it's really, really important. This issue is so divisive, right? And everybody has an opinion on it. Everybody wants to have their voice, and everybody's frustrated by the lack of our ability as a society to solve what is an imminently solvable issue, right? Homelessness, right? And so they're looking for some place to engage and have their voice heard, right? And it's very difficult when there are all these entities and you don't have an understanding that if I go and I talk about this thing to that group, can they even do anything about it, right? And so the way I think of the work of the Continuum of Care Board as it relates to the things we control and don't is in really 3 buckets of activities. And we talk about this all the time, right? Bucket 1 are those things we completely control, right? And we can talk maybe about some of those later, right? If there's for instance, if there's a policy decision that needs to be made about the homeless management information system, we can do that. right? Now we would want to seek input elsewhere, but we can take a vote and we can make a policy change, right? That's bucket number one, those things that we control completely. Bucket two are things we share with groups like the county or the housing authorities or cities or other groups that we have a shared authority around. And then bucket number three are things that we are keenly interested in because they impact the system, but we have no authority. And so if we want to impact those, we have to partner, collaborate, use the bully pulpit, educate, inform, or whatever. So that's the way we kind of try to think about the work that we do. And so when people come and engage us, I try to do my best to educate them. Like, that is not, like, if we took that decision, that would usurp the Santa Ana City Council or the Board of Supervisors or a housing authority. So we have to be really careful about that separation of authority and powers, but I know that can be confusing for the public when they try to engage.
Thank you for adding to that. And I did see we had a question that popped in the chat box about the Commission to End Homelessness and what the relationship is between the Commission and the Continuum of Care. I don't know if either of you want to respond to that one.
I think that's well in Tim's domain again.
So yeah, there's a relationship in that we actually share some board members. We share our commission and board members. Some of the Continuum of Care Board members serve on the commission and vice versa. There's also some shared staffing. The Office of Care Coordination also staffs the Commission on Homelessness. The biggest difference is the Commission on Homelessness really doesn't have any funds that they allocate. They have no funding allocation authority around anything. They serve as more of an advisory group to the Board of Supervisors. I think they're starting to get more active, and starting to do some more things. I know they put out a study this last year. They're looking at some other activities. But they don't really have a lot of formal authority over parts of the system. We are charged literally with the prioritization and disbursement and overseeing that the contracting is done for the HUD dollars that come through us on an annual basis, and a series of other state dollars, that come through us. And then we also have responsibilities around data and evaluation of the system and ensuring fluidity and effectiveness of the system. So we carry a lot of responsibility for how the system operates. The commission is more an advisory group that gathers information and shares that up to the Board of Supervisors and out to the general public.
Yeah, thank you. And I will just highlight that last piece, that the Commission to End Homelessness does report to the Board of Supervisors. The Continuum of Care does not report to the Board of Supervisors. So I just want to underscore that part. So now that we have sort of ascertained what the Continuum of Care is and what it is not, let's talk about what it looks like. How is the board organized to actually accomplish these things that we were talking about? Managing data, the oversight of HMIS, building an effective system, getting funding out into the community. And Shauntina, I'll start with you.
Sure. So I think one of the cool things about the Continuum of Care Board is all of the input that we have. And I think that I'll even start with the committees, because I think that's a great place to start. So we have several committees that are connected to the Continuum of Care Board, specifically around special populations. Like we have a transitional age youth committee, we have a veterans committee, we have a lived experience committee. So those are some great ways. We have a domestic violence committee. So we have folks who have expertise who are feeding into our system and the way we think about things and the way we talk about things. And I think that's important. Then the second layer of committees we have are around these systems that Bexy just mentioned. So we have an HMIS committee. We have a coordinated entry, and that's the homeless management information system that Tim talked about earlier. We'll go back and forth between our acronyms, but try and explain them. And then a CES, or coordinated entry system committee. So we have committees around our functions as well. And then we have a policy and procedure committee, as Tim mentioned, policies that come up. So with all of these different groups, we're able to have people who are in it on the ground, helping make decisions with us and alongside of us, and creating what needs to come to the board so that decisions can be made. So I think that's an important part, to really start with the community facing pieces of our committee, and folks can join those at any time. If you have questions, thoughts, that's also a great way to learn. It's a great foot in the door at the board, and really just to start to understand some of the mechanisms and pieces. So I'll highlight that first. and then talk about what comes after that is the board itself. So the board is made up of general membership, as Tim mentioned, and as he also mentioned, anyone can join. So you can join as an individual or part of your agency and become part of the general membership. Our meetings are open to the public. So COC board meetings that are once a month at the county building downtown in Santa Ana, anyone can come. General public is welcome. You can give comment on any of the items that we are discussing. The board packet and agenda is posted before. Michael's put the link in the chat. So you can learn about what we're going to be talking about. Come and speak to us at any time. So I think that's it. The board in of itself has our 3 officer positions, the chair, the vice chair, and the secretary. And then we have board members who all are voting members on our board, contributing to the decisions we make in our system. And then you also have folks who are chairs of committees, and those chairs of committees help bring topics to the board as well as take things from the board to go out and help us to actually fulfill in our work. And so that's just a little bit more of the organization. I saw a question about a flow chart, and I love a good organizational chart. So that could be something we could definitely create and put out there for sure to just help with all of those different moving pieces. I will then turn it over to Tim to talk about more of the technical aspects between some of the other pieces.
I think, Tim, if I can just
Sure,
jump in quickly here. So as Shauntina mentioned, there are a lot of committees, and there's also a lot of ad hocs, and all of that receives support from the staff. And so I do want to give a shout out to Sarah Jones, the Continuum of Care manager, who I know is watching today. So yay, Sarah, and to your team. It's a lot of work to support the work of the board. And so there's a tremendous amount that goes into getting all of those things scheduled, never a dull moment, always a committee or an ad hoc to be a part of. And then, Tim, as you talk, I really would like you to talk about the work that the board underwent in 2023 to become more diverse and more representative of the people that we are serving. So I would love if you could share with everybody more about that process and what it has resulted in.
You bet. Jumping off something that Shauntina said too, just want to drive this home about the committees, right? And I'm going to return to this theme many times, and people who know me and talk to me about the Continuum of Care Board outside of here have heard me say this many times. It's one of the only places that the public has to come that has some power and some authority to move things in the system, where you can literally come and have your voice heard, and we can make some changes. We can make differences. We have examples of when people have come and given us public comments, or when people from the Housing Opportunity Committee or whatever have given us, information, data, ideas, that we're able to incorporate those in. So it's a place where you can have some efficacy. And the committees in particular, as Shauntina said, those are not just open to COC board members. You go to our Housing Opportunities Committee, and it's a robust group. If you want to learn about what's going on in actually housing construction and permanent supportive housing in the community, housing vouchers, that kind of thing, that's chaired by Judson Brown from the city of Santa Ana. And you go there, Jamboree Housing is there, National Community Renaissance is there, other cities are there. So really encourage you to, get involved with some of the committees. We also have a service provider forum that, for our professionals that are working in the field, it's such a great information sharing and professional development type of opportunity, and we're working to bolster that. But as Bex was mentioning, a few years ago, actually when I was chair the last time, one of the priorities that I set out, and I believe that when you chair something, you should probably think about, what are some things I want to really, while I've got the bully pulpit, what can I put my shoulder behind? And there were 2 things. One was really ensuring that we had the perspectives of people with lived experience permeated throughout, not just over there in the corner, like we'll come talk to you when we need to tell people that we did it, but that their perspectives are actually informing policies and procedures and priorities. And so we formed a lived experience advisory committee that is chaired by the wonderful Nicole Gideon, who serves as the secretary of the COC board. They are not just parked over there. They literally, when we have conversations about policies, someone's going to bring up, has this gone through the Lived Experience Advisory Committee yet? Perhaps they should have a go at this and give us their recommendations. So that was one thing. But another thing that we did was we really, we implemented a racial equity assessment of the homeless service system, which was, I will tell you, a painful process, but good pain. right? We had to confront some uncomfortable truths about our own organization and how we had been functioning up to that point, and the extent to which we had made the proper efforts to really create an authentic inclusion and engagement, not just DEI washing or doing it for the sake of it or checking boxes. And so that eventually, that strategy that emerged from that process informed our nominating process and the way we actually nominate members to the board. And I will say it worked with flying colors, with a little intention and strategy and getting everybody sort of on a set of shared values, and then implementing policies and procedures that point you in the right direction and good outreach and engagement. It's magic. It's not magic, but it seems like magic that all of a sudden, all those folks that everybody says, oh, well, we can't find people who have this type of experience or this type of background. Funny how they come out of the woodwork when you just do the right things and create an illuminated pathway for them. And that's what we did. We have the most diverse board that we've ever had at this point. We have people who have perspectives ranging from Indigenous folks to LGBTQ folks to people with expertise around transitional age youth and domestic violence and veteran services and families and homelessness across the board, and couldn't be more proud. In fact, during the last election, I was looking at it going, maybe it's time for me to, like, this next generation is coming in, and we actually, from an age perspective and an experience perspective, it's very balanced now as well, which is a really good thing, hearing from the next generation of leaders and having them involved. So yeah, I probably went on a little too long about that, but I'm passionate about it. And I feel very strongly like that's something we've done in the last, say, 2 years that I'm most proud of.
Bex, I was just going to add, because I saw a question come through, because Tim, I think you highlighted some important points about the intentionality and pieces there, but wanted to add, because you had asked an original question and I got carried away with committees and wanted to make sure I circled back on it, but really about the coordinating of the agencies and delegating the funding and the data. And then I saw a question come through about legal operations. And so I just thought I could tailor this in and connect the dots. So we, as the COC board, help determine buckets of funding to go towards certain things. So let's say, for example, we say, okay, this money should go towards prevention, this money should go towards permanent supportive housing, this money should go towards data. That is where our decision-making rests. The county administrative entity, Office of Care Coordination, then contracts out those dollars, as Bex was saying. They are the ones that hold the power, if you will, right? And like how those things actually get out to RFP. Now, there are committees that are selected to review those RFPs. So the board does not sit and go, this agency, that agency, this agency, that agency. We don't do that as a board. But we do have NOFO committees, or notice of opportunity of funding committees, that help review with a rubric, with lots of guidelines, who is meeting the criteria of that funding, of the need. And then that is what actually gets selected for projects that go out, and the county holds and administers those contracts. And so I think that answers the question, but then also wraps up that other piece. And then kind of same thing with data. The COC board is not like in charge of all the data, but we drive data that should be collected, data and how it should be used, and then we use data to inform our decisions. So to Tim's point, the C4 data we use to inform who should be on the board, what should be made up of the board. We use the data in the HMIS, the homeless management system, to determine what projects need more funding and where should we be looking. And we're actually embarking on another piece to add more data to our system about our investments. So just wanted to wrap up that question, because I know Tim and I are so passionate about some things and carried away, but that's the other pieces to add.
You know, let me add to that a little bit, because I think it's really important, something you said there, Shauntina, that the public doesn't see a lot, right? The folks who come to our meeting, right, they see us like, oh, there's an agenda item, and here's the staff, presentation. Oh, there's some discussion about it. Oh, they've made the vote, right? And it's a vote on how to spend, $8 million or something. And people sitting in the audience are like, oh, well, that seemed like, shouldn't there be more? Trust me when I tell you, the conversation that happens before that, through our committees, through our policies, procedures, and standards committee, through the ad hoc committees that are put together to actually make the funding recommendations up to the board. And then, as Shauntina said, the rubrics that are developed, like the guidelines that we work both with HUD on the HUD funding, like some of that we don't have any discretion over. HUD says this is what the funds are going to be used for and when we implement it, right? But the areas where we do have discretion, we go to great lengths to make sure that we have a good data collection, data analysis, and then expert, input, and then, lived experience input, all those types of things that matter before it comes to the board. And you just see maybe a quick vote that seems very quick to you, but there's a lot of stuff that happened. And more, and this is an opportunity for some of you listening, more and more, some of these ad hoc committees we're opening up to non-board members, right? Where we have a mix of board members and non-board members who we feel like if we're gonna look at a particular area in the system, wouldn't it be great to have a few people who maybe understand that a little bit more? And if it's not represented on the board, we'll go out and we'll find folks to serve on an ad hoc and help us make those decisions.
Thank you so much. I'm really proud of the work that the board did last year. It was a big process. So for anybody watching, what happens once a year is that the board governance charter is reviewed. The governance charter is what states sort of the makeup of the board and the process that's used to appoint new board members. So that governance charter got a huge shakeup this last year. The governance charter is available on the Continuum of Care webpage. I believe the link has been popped in there, but that is available to be viewed there. That talks about the structure of the board. And so once a year that gets looked at before recruitment process opens up for potential new board members. So that happens in more of like the very end of the summer, fall. So if anybody is interested, that's sort of the timeline. And if you want to be able to get the information about that, make sure you sign up for the COC emails that you can do on that webpage link. It's probably just got dropped back into the chat box, so it's right there. So you can get signed up for those emails to receive the information. And then if you're an individual or an organization that's not a COC member yet, fill out the membership form so you can become a member as well. So a few little tidbits that I wanted to add in there. And talking of change on the COC board, one of the processes that we underwent under your leadership, Tim, was creating a 3-year vision for the Continuum of Care. Tell us a bit more about what prompted that change, what was created, where we are in the midst of all of this.
Sure. Yeah. So a few years ago, for most of its existence, the Continuum of Care Board has really existed to pass through, and that sounds so passive, and I don't mean it to, but that's been the role really, is the HUD dollars, the HUD Continuum of Care Supernova dollars that I talked about that we got way back in the day. We get those on an annual basis, so long as we're meeting, and there's only been 1 year, I have my little handy dandy thing here, 1 year since 1996, we haven't gotten renewed, and that was 97. That was a way long time ago. So we get these dollars, and so we have to make sure that we have all the structures and mechanisms, in place for that. And that's been the history of the COC board. What happened a few years ago is that the state of California discovered, well, lo and behold, we want to start allocating more resources to ending homelessness. And hey, there are these groups that are already in place in communities all over California called Continuums of Care. And so why wouldn't we use the existing structures to pass some of these dollars through there? They already have a decision-making process. They already have an inclusive kind of platform, to make these types of decisions. So we started seeing state dollars that were coming through. That not only significantly bumped up the amount of money that was running through the Continuum of Care Board out into the community, but it also ratcheted up our staffing needs. It ratcheted up the need to have different types of people and voices represented on our board and on our committees. And so in response to that, when you're just kind of doing the same thing every single year, you just got to make sure that's functioning. The need to have kind of a strategic vision that includes things like collaboration and partnership and community leadership and communications and, marketing, those types of things, not as important. When now you are a discretionary funder of these types of activities to a pretty large degree, we have to do things differently. And to put it no other way, we have to do things differently. So we put together an ad hoc committee that began what I call a strategic visioning process, where we kind of said, hey, if a miracle happened overnight and we were magically transported 3 years into the future, what would we want the system to look like? What would we want the parts of the system that the COC is either has control over, is partnering with others on, or is interested in moving, right? What do we want those to look like? And then build that down into what I call a march to specificity, right? So that we go from some big, broad strategic aims over the next 3 years into some measurable objectives, strategies, tactics. And then how are we communicating all of that and creating a sense of transparency? And here's the big one, accountability. My biggest beef with, I've been doing this a long, long time, and my biggest beef is that everybody gets to kick this can down the road or kick the soccer ball to another player. And when it comes to accountability for ending homelessness in our region. And I kind of just offered up the very simple, idea that we'll do it. We'll take the accountability. We don't control every part of the system, but you know what? HUD has mandated that we make sure that the system is fluid, that the system is efficient, that the system is effective. And we do control an awful lot or have partnerships where we can move parts of the system to make them more effective. So we should probably take some more accountability. So that's what led to us. And you can actually go on the website and you can look at the strategic aims that we have under that leadership vision. I'm really excited that we're on the verge of now taking the next step with that and want you all to engage with it. I hope you'll come to, committee meetings and come to board meetings when we discuss this, and that we are now making that more specific. So we have currently, I think we have 6 strategic aims, for the Continuum of Care Board over the next 3 years. I won't go over all of them because that would take too long to read them, but they're really exciting because they take us in little bit different directions than we have traditionally been. And they're going to cause us actually to work some muscles that we haven't worked before. Like, how do we more effectively partner with others in the community? When you're just passing through HUD money, you don't have to be all that concerned about the partnerships, right? Now we do. And let me give you one example, right? We are responsible for a state pot of money, the homeless housing HAP, homeless housing assistance and prevention. Yeah, I always get it. HAP dollars, right? So this is dollars that come from the state. We're not the only ones who get it. Continuum of Care Board gets an allocation of about $8 million. The County of Orange gets an allocation separate from us. The City of Irvine, the City of Santa Ana, City of Anaheim all get allocations. We have to collectively develop a plan that we all have to align our dollars to that we're spending. It's ridiculous for us to just sit in silos and do that, right? Well, that's something that we have to plan for. We have to be better partners. We have to be better collaborators, even with private philanthropy. Like, how are they spending their dollars? How are we coordinating and mapping the resources in the community so that we can make better decisions and meet needs as they emerge? So really excited about the future of that. You'll be hearing more as we kind of re-engage this process and get more specific with it.
And really quickly, I'll just wrap up with the progress made so far, because Tim does a good job of the why, right, and the how. So some of the things we've already talked about. So one of our goals is promote an equitable and just system. That racial equity profile we did was part of that work and thought process. And then diversifying our board was another big step in that process. The other thing it calls out in our very first point about really just ending homelessness, and it calls out some special categories, veterans and families. And so very specifically at the board level, those committees that we've talked to. So we've applied for youth homelessness demonstration funding twice. We had just with collaboration of United Way applied for the Youth Homelessness Services Initiative, YISI is what we're calling it, right? So we're waiting to hear back on those, but there has been more movement because of that document in some of these areas, very intentionally, to Tim's point, with accountability around some of the things we call out. It gives us the guidance and to say, we said we were going to do it, so now we've got to do it. And so that document is driving a lot of our decisions and behavior.
What does TAY mean?
Oh, transitional age youth. Thank you, Bex. And that typically is defined 16 to 24 in most categories, some people 18 to 25, but and for HUD, they have a very specific definition around transitional age youth, and it's 16 to 24 youth who are experiencing homelessness, whether that is by couch surfing, living in their cars, living with friends, but not having a stable place to live.
Thank you. So I want to ask a slightly different sort of a question, a bit more of a personal question. And Shauntina, I'm going to come right back to start with you. What is it that you're excited for the next year for the COC?
Sure. You probably have sensed it or felt it as you're watching this. I think we have a board now that actually represents those in our community who, one, are experiencing homelessness, but two, also have a deeper understanding of it. And not to say that people didn't before, but I think we intentionally have a very different board and group of folks. And so I'm really excited to actually see some of the decisions that come when you have the voices of those most impacted. I know we have a committee starting around HHAP, as Tim talked about, to really talk about how to allocate those funds in ways that are going to affect our most under-resourced populations. And so I'm excited about that. I think I am hopeful about either our youth funding sources, that if we could attach to one of those, or if not, the system contribute to that in a way to actually be able to elevate youth voice and figure out solutions. We know that Tennessee and Washington has reduced homelessness by over 50% for transitional age youth. I don't see why Orange County couldn't be number 3 to do that. So really excited about some of those. And I think we have the right partners and the groundwork to do it. So those are 2 of my passion things that I'm excited about this year.
Thanks,
Yeah,
Shauntina.
that's great.
Tim.
Yeah, the few things that I'm really hoping to push forward, in this coming year is, one is, I go back to the collaboration and engagement part of it. We're really looking at how we can create more of an ease of engagement for the general public, for people in the system, for service providers, for, basically people who are interested in wanting to contribute to ending homelessness, right? How can we make it easier for them to engage and communicate more effectively with them? I'm really excited about the United Way 211 merger. 211 is contracted with the Continuum of Care Board to manage the homeless management information system and do our data analysis. And so now, connected to the wonderful storytelling ability of United Way, I think we can do a lot there to help people understand the issue a little bit better, and then they can engage more effectively, and not feel so hopeless, about it, that we can solve this. I also think that finishing the strategic planning process that I talked about, I'm also really excited about our increasing engagement from our folks with lived experience and our ability to compensate them fairly for the work that they do. We're really working on getting that stuff in place. I'm looking forward to that happening soon. And the last thing I'll mention is better data analysis and integration, right? There's a lot of data sources out there, and we can get a wash in data. We need a much better system of choosing the data that is really telling us the story, and then also connecting it to that storytelling element, and letting the public know where we're really making some, like what Shauntina was talking about. Like, hey, if we did have some real progress, real verifiable progress, we can prove it in TAY, or in families, or whatever, or the reverse, that we're transparent, that, hey, the data is telling us we're not doing well enough in these areas. We have to plan around that. We got to do something differently. So I'm really looking forward to pushing those things in the coming year.
Thank you. And just to come back again to how people can get involved. I know that you've both spoken about this as we've gone through, but if just to reiterate, if somebody is watching, which I know they are, and they're saying, how do I get involved? What are some avenues in which they can participate?
Hi, Shauntina.
Oh, Shauntina, you're on mute. We can't hear you.
So good. All right. So, but no, you definitely, like, you've heard me say it, but I'm going to say it even more clearly, is the committees is a great first step. So the committees are all listed on that website that is posted in the chat. You can look up any of our former meetings. You can look up future meetings. You can look up the agenda. It should have a Zoom link or a location, depending on the meeting type, that you can join. Anyone can join. If you have an interest, you can join all of them. You can attend all of them. That is totally up to you. And then maybe you can figure out which one you feel like you have the best input and connection for. Maybe it's a few of them, but any of those committee meetings, anyone is welcome to join. We would love to see you at a board meeting, and you are welcome to join anytime and to come to give public comment, talk to us before or after. Many of us are around listening to folks, talking with folks. That's another way to connect. You also can always email any opinions, thoughts, and comments into this Continuum of Care. They have a email address posted, so you can always submit that way if you can't make it to a board meeting. The other ways to become a general member of the COC, there's a form listed on that same website posted where you fill it out. It's a one-page form. It is not very hard. However, if you need help or assistance in completing, one of the office staff can help in completing that form to get that in, and then you become a general member. And that would just ensure that you're getting, you know, the information. There's email listservs you can join. There's listening. There's so many ways. There's listening sessions that are often posted where you can join, give your thoughts, give your opinions around certain topics. I saw comments in the chat, right, about like different things. There are actually places for you to come and give those opinions and thoughts, and we want to hear them. So those are just to name a few of the ways to get involved and to start, but we would love to have you as part of the work that we're doing.
Yeah, so I ditto everything Shauntina said, like 100%. I'm going to take a little bit of a different tack and just encourage you all that even if it's not directly with the COC, please get involved. Go to a homelessness 101 class or promote those that the United End Homelessness puts on. Michael Shepard runs the housing advocacy group for United Way that I was heavily involved in early on, and I advocate here in my city of Irvine, because none of this stuff works unless we are producing enough housing. Housing ends homelessness. I'm going to do my Don Price impression. Housing ends homelessness, housing ends homelessness, housing ends homelessness. We need to deal with people's issues and help them deal with their issues effectively, but that's where permanent supportive housing comes in and supportive services and things like that. The bottom line is the system bottlenecks because we don't have enough affordable housing. And so you getting involved with your city council, that's where the action happens, and letting them know that you care and they need to vote the right way. They need to approve affordable housing projects. They need to promote them. And then I would also say, you know, one of the things I've told people this before who have asked me, who should I give to? My personal, where should I volunteer? Who should I give to? Give to the organizations we fund. Because I guarantee you, then you don't have to do that. We did the due diligence for you. I guarantee you, if we're funding an organization, they're pretty much worthy of your funds as well, right? So if you're looking at your charitable giving throughout the year, at the end of the year, you know, look at the organizations that we're funding. I'm not going to start listing them here because then I'll leave some of them out. Like there's a bunch of really great organizations. Those are the ones that you should get involved in. Some of them need volunteers, some of them need in-kind support, and all of them need funding. Right. So make your contributions there and use us as a guide.
I ditto all of that and definitely applaud the going to your city council. We need our cities to be on board with allowing affordable housing in their areas and our programs for sure.
Absolutely. So wildcard question as we're coming in to end our time together. What else would you like somebody watching to know about the Continuum of Care that we haven't covered yet?
We've covered a lot. We've covered a lot. I guess I think the thing that I would say is probably many people may be used to interacting with an entity that is not actually listening, that is not actually hearing them, that is not actually able to figure out how to best utilize their voice. And I'm not saying by purpose or design, but I think we have really been intentional about creating that at the COC. So if you do have an opinion, if you do have a thought, there is a place to put that. I would say start with emailing the COC. We can direct you in those ways, but I do believe that we have designed ourselves in a way to truly take what is happening and hearing those voices and finding ways to have them have a place to land that is going to help us build a better system.
I agree 100% with that. And I would just maybe as a final comment, I would say, don't lose hope that we can end homelessness, please. It's been a long haul for me. And you know, even still, I deal with bouts of hopelessness around it. Sometimes it feels like one step up and two steps back, you know, but we're going to focus a little bit more. I was just talking with Jason Phillips, who's one of our great board members, who reads the names of all of the people that we lost who were unhoused at our board meetings every time. And it's very effective. I encourage them to continue to do that. But one of the things that we talked about doing that I talked with the staff about, we're going to start doing in May, is actually sharing more success stories there, right? Though, because the work that we have done together has saved people's lives. There are people who are living in their own homes and having wonderful lives now, wonderful quality of life now, re-engaging with family and with friends and able to pursue their interests and hold down employment and all those things. And we need to share those stories more effectively. From the homeless cost study that United Way did with UCI, that we literally spend more money to keep people homeless than it would cost to simply house them all, which is ridiculous. If an alien landed here and that's what we told them, yes, this misery, we pay more for that to be in place. It's ridiculous. We know how to solve it. It's just that we need the critical mass of people to support, to stay diligent, to join us, to lock arms with us, and we can make it happen. So don't lose hope. Join us wherever you can. Talk to us, contact us. We'll tell you how to get involved. And we need you. We need your voice.
When is the next CRC board meeting?
Since it's mine and I'll be chairing it, it's next
Yes, I'm out of
Wednesday. It is next Wednesday downtown Santa Ana at the County Administrative Building. And we will be there. It starts at 2 p.m. and it's slotted till 5. We don't generally make it to 5, but it could, you never know. So we will be there from 2 to 5 next Wednesday afternoon, downtown Santa Ana County Administrative Building. Follow the signs once you're on campus. It is a little bit of walk through the campus.
Perfect. Thank you so much. This has been such a robust dialogue. We covered a lot of ground today. So thank you so much, Tim and Shauntina, for providing information in an easily accessible way for our attendees. And thank you to everybody who tuned in. It was amazing to see so many of you joined us live. This video will live on YouTube. So if you need to come back to it because you're like, oh, I missed something, it will go up on YouTube. And feel free to send it to any of your colleagues, friends, family members, city council members to help them understand what the continuum of care is. Little update on what we're going to be talking about in May at our next community chat. We're actually going to be beginning a 3-part series looking specifically at young adult homelessness. As you heard from both Shauntina and Tim, this is an area that the CRC board is really interested in looking at. This is an area that over here at United Way with United to End Homelessness, we're really interested in looking at. So we're going to be doing a 3-part series, deep dive into youth homelessness. We'll be bringing in some national experts as well as some local experts. So we look forward to seeing you then. An exit survey is going to pop up on the screens if you're joining us live here on Zoom. Please make sure to fill it out. We take your feedback seriously and we use it to help improve our community chats moving forward. So thank you to everybody for joining us today. Thank you, Tim. Thank you, Shauntina. We will see you next time in May.